everyone, I'm Aditi Lamba and you're watching ITV Gold. Welcome to another edition of Desis in Health with Dr. Soma Mandal. Our ongoing push towards South Asian health awareness and so much more continues, and that's why we bring you this exciting series in which Dr. Soma, who is very passionate about women's health, in educating people and really figuring out the resources to help them, brings forth all logistics and all knowledge that we need to know to really promote good health. So welcome on the show today on a topic that really truly empowers women and something that we should all talk about. A topic that we often call taboo in our community, but today Dr. Soma Mandal will be joining us and discussing a lot with us on that topic. So on the show today we have Dr. Soma. Thank you so much for being with us yet again, Dr. Soma.
Hi, thank you.
We have had such a great time having you here, and it was amazing for you to take a topic like fertility in the last episode, and now we bring forth another very interesting topic that they will find out in just a few minutes. But right before that, I would like for you to discuss why is this so important for all of us to really promote good health, and also why is it that you're so passionate about it?
So Aditi, my passion is women's health, as you know, and specifically I have an interest in helping South Asian patients just because I am South Asian, and it gives me a lot of pride and joy to help my own community out. And we are so at risk for so many diseases that we need the most guidance to help us guide through those things so that we can minimize our risk and take care of ourselves the best way we can.
Definitely, and that is why we are bringing you this series in which Dr. Soma Mandal has agreed to give us all the tips, all the key high-risk factors, and so much more. So let's go into our topic now?
Sure.
Definitely, let's join. Well, here we have again, everyone, another edition of Desis in Health with none other than Dr. Soma Mandal on the show with us. Thank you so much for joining us again on ITV Gold.
Thanks for having me again.
You know, we got such an amazing response to the first episode of Desis in Health that we're so excited to bring to you all this edition on a topic that we promised you will also relate and would really impact women. Wouldn't you say that, Dr. Soma?
Yes, definitely.
So we're really trying to bring forth some messages of understanding what it truly means to have South Asian health awareness and what it truly means to understand what it can do to, take care of yourself and how to really make yourself feel better. So on the show today, Dr. Soma brings to us a very interesting topic that impacts millions of women around the globe and an issue that impacts South Asian women massively. We're talking today about the issue of menopause. Dr. Soma, I want to thank you for bringing forth such, topics of, women's health issues that really impact their lives, but it's also these issues that I feel that at times it's a taboo topic. Nobody talks about it when it comes to women's health in a lot of South Asian culture. We're still not well aware, and the knowledge is not there. Wouldn't you say that, Dr. Soma?
That's definitely right. There's so much taboo in our culture that women don't necessarily come out and talk about these things themselves.
And just talking about the topic of menopause, as we were just discussing right before this, that's probably one of the most taboo topics, right? And if you were talking about the fact that now there's a movement of, menstrual cycle awareness in India or the parts of South Asia, there's also a movement for understanding what menopause is for everybody else. So in that terms, for our audience, doctor, I would love for you to make them understand, what is menopause? And the impact of that on women, and especially the impact on South Asian women, as you've seen.
Sure. So the impact of menopause on South Asian women, I find to be slightly different than in other populations.
Right.
And the first thing that I have to say is that menopause is not a disease. It's a natural state that happens to all women as we get older. Most women, the average age of menopause for a South Asian woman is slightly lower than other cultures, other ethnicities. The average age is usually about 47.
For women?
For women.
That are South Asian?
That are South Asian, yes.
That's very young.
That is, Yes, I
Right?
think of it as young, but that being said, it can happen as early as your 30s to anywhere in your early to mid 50s. But the average age across, South Asia as well as Indian women abroad
Right.
is usually 47.
Doctor, in a very simple term, menopause is the stopping of your menstrual cycle, which is a huge part of women's health. It's a huge part of all of us growing. It's a huge part of, the time of pregnancy, giving birth, and so much more. So a reversal of the menstrual cycle is exactly what menopause is. So could you describe to us and also educate me into what I've said right or wrong? And also explain to our audiences, I would love for them to know, why is it so important for us to discuss this?
It's a very important thing because in South Asia, and then for South Asians who are also abroad, we are more prone to certain conditions.
Right.
And going through menopause actually increases our risk for those conditions as well. And a lot of people are not aware of that. So it's very important to understand what is happening to our body, not just hormonally, but
Right.
what you're at risk for going forward.
And what exactly is that process? What happens? If you were to describe to anybody that didn't know the impact of menopause on a woman's body, how would you simply describe that?
So menopause is not like a thief in the night. It doesn't happen abruptly, and that's a big myth that a lot of people think. That's what happens, that your menstrual cycle just suddenly stops. The truth is that menopause, or I should say its friend, perimenopause, happens anywhere as early as your late 30s to 50. And there is such a thing called, early menopause, which can happen earlier, but this is the state of most women where signs and symptoms slowly start happening that we may or may not be aware of, but it's a gradual process that happens until that very last menstrual cycle ends.
I have to ask you, in the South Asian culture, the menstrual cycle or the attachment of women to giving birth and, fertility, that was our topic of discussion in the last episode for everyone. That has been such a huge narrative of the South Asian woman. I would like for you to sort of briefly reflect on what you think the narrative becomes of that woman in menopause, and what is, what happens to that person during that time period?
So for each woman, and I'm referring to South Asian women in general,
Right.
it can present differently. For some women, it can present as just general fatigue. For other women, it can present as just joint pains, back pain, knee pain, and they don't know why. And even when we do x-rays or other tests, nothing specifically comes up. Some women can present with hot flashes, with mood swings, with decreased libido. Other changes are like dry skin, dry hair, changes in your hair texture. So it can be very broad and very vague.
Time to take a short break, but stay with us. We'll be right back on Desis in Health with Dr. Soma Mandal. And welcome again. You are watching Desis in Health with Dr. Soma Mandal, and I'm Aditi Lamba. On the show today, the topic of discussion is menopause affecting millions of women globally. Dr. Soma, right before the break, we were discussing the impact of menopause on South Asians, and how it is often quite taboo for certain women to handle that, and also they often don't know that that could be a reason for other issues that can come in their health during that time period. I know you had some case studies to discuss with us. I would love for you right now to, sort of open this floor up to our audiences and really, make them understand what is going on and what kind of patients, do you interact with that?
So most South Asian women who come into my office come in with fatigue. That's a very big symptom that people present with, joint pains, and just general malaise. So unlike other ethnicities, the hot flashes, the cold sweats that other people present with is not often a big complaint within my South Asian patient population.
But are there any certain, is there a time period that you often have these patients come in? Is there a time frame of where the women realize that, okay, maybe there's something more wrong with my body, I'm just not feeling well? How do they sort of navigate this? Nobody's talking to them about it.
Nobody's
either.
talking to them
Yes.
about it, so they come in thinking that, there's some type of vitamin deficiency.
Okay.
And the truth is there usually is, but it doesn't fully explain
Right.
what's going on. So fatigue is a big complaint, and it can present anywhere from your 30s to your early 50s. And we do a whole comprehensive workup of what's going on, which includes blood work, hormonal testing to see what is causing this fatigue. Most of the time, those labs come back normal, for example, thyroid, your blood counts. A lot of times, and this is prevalent within the South Asian population, especially those who are premenopausal or menopausal, there are issues like iron deficiency and vitamin D deficiency.
Right.
We correct those things. We guide them to eat better or take supplements to help themselves, but the fatigue is still prevalent. So that's when I sit down with the patient and say, let's talk about possibly this may be perimenopausal related,
Right.
and what we need to do going forward.
Dr. Soma, give me like an age bracket for women that you think are in perimenopausal stages, as well as age brackets that you've seen for proper menopause and the time periods taken them, and also what are the highest symptoms you would say in that regards with those age brackets?
Sure.
Go for it.
So most of the time it's from your mid to late 30s to your early to mid 50s, and it can be so vague that it's often in the back burner of my mind, but it's always there as a potential reason for the cause of the symptoms that the patient is complaining about.
And for women that are closer to that stage and are perhaps more aware, are there particular things that they should definitely watch out for when that increases that you recommend that they should go see a doctor?
So in general, the South Asian population, there is a higher risk for certain conditions, which we'll talk about.
Right.
But in general, that particular state of being premenopausal or menopausal itself, you are prone to more fatigue, prone to more sleepless nights, prone to more irritability. And these are things to be watchful for, so that if you're experiencing these issues, you're not wondering what's going on with me.
I kind of actually want to bring us into the diseases attached, because I think that was very important for us to sort of reflect on. And since you've hinted on it, I would like for you to for our viewers to understand, why is it so important for us to understand why women are getting this in order to prevent them from other future health diseases or worsen something that they could have. And I think that's your major concern too, I'm sure, when it comes to your patients in that regard. What's your comment on this? And what are these these diseases that we're talking about? What are these that we're, really reflecting on?
South Asian patients, whether in India or abroad,
Right.
we are at higher risk for diabetes, for heart disease, for osteoporosis, for stroke, for breast cancer.
Right.
And these are all conditions, whether it's because we're getting older or going through menopause, the risk can increase. So we need to be watchful and see our doctors so we can get appropriately screened and tested.
What key diseases do you think are very, very prevalent and somewhat associated, or you've noticed have been associated with menopause? And do the conditions get worse for women when they hit menopause?
In general,
Yeah.
South Asians are more at risk for osteoporosis. And the key hormone in menopause, perimenopause or menopause, is estrogen. And as we are going through menopause, the estrogen levels decline, and that plays a big role in bone health. So the rates of osteopenia and osteoporosis increase.
So that is a direct impact on their bone health.
That's correct.
And then I remember you discussing with us a huge impact on heart health and heart diseases as well. How does that work with menopause?
We know that estrogen is protective, our natural estrogen. So whether it's women who are presenting at that time because they're getting older,
right.
Who are more at risk for heart disease, or because of that key hormone estrogen playing a role, women, particularly South Asian women, are more at risk for heart disease.
Oh, wow. Well, a lot more coming on the show with what we can do with all these high risk factors that impact women, and also how to treat yourself if you are going through menopause, and how to look out for help coming right after the show. Stay with us. And welcome again. You are watching Desis in Health with Dr. Soma Mandal, and I'm your host Aditi Lamba. On the show today, we are talking about a very pertinent topic, the topic of menopause affecting so many women around us. Dr. Soma, right before the break, we were reflecting upon the issues of menopause and also how it directly relates to a lot of very high-risk health issues in South Asians, be it heart disease, be it diabetes, and osteoporosis, and so much and so forth. I would like for you to discuss if you've ever, gone through a case in which you've seen these conditions come up, and also a bit more on what we have to watch out for in terms of maintaining this healthy balance.
Sure. So let's say I have a 50-year-old woman who comes into my office.
Right.
And she may still be menstruating, and I'm referring to a South Asian patient here.
Okay.
She may still be menstruating, but she's feeling very tired. She's feeling malaise. She can't sleep well at night. That's when I do a whole workup for her, which again includes blood work, and it also includes testing for her heart, as well as making sure she's not diabetic, and checking to make sure that her bones are healthy. And the reason why I do these things is because, again, we are more at risk for these types of conditions. And yes, it may not necessarily present as fatigue itself, but it's a comprehensive test. You're not just focusing on what the patient is complaining about. You're making sure that her entire health is being addressed.
And with women having, especially from the South Asian communities, having a really high risk of, say, breast cancer and other parts of it, would that also impact, them even more after their menopause starts?
So breast cancer, there's no higher risk of breast cancer because of menopause. It's more of an age-related thing. So that's a myth that I often have to educate patients about. Exactly. So as we get older, though, our risk for breast cancer increases, but not due to menopause.
Dr. Soma, when we're discussing this, and I'm sure a lot of women watching the show would also understand that it's as if your entire environmental and existential process is turning around and it's changing, and that's how some people describe menopause as.
Sure.
And then there's a lot that body is going through during that time period. How do women usually handle that? And perhaps I am opening a room for talking more on treatments and how to really, combat it, but this must be really tough on the human body, correct?
The truth is, it can be variable. It can be so variable. Some women have very minimal symptoms to no symptoms.
Right.
And then there are other women who have experienced the whole gamut of, hot flashes, mood swings, irritability, not being able to sleep, fatigue. So it differs from person to person. That being said, whether the person is asymptomatic or not, or having a lot of symptoms, I still do that whole comprehensive workup I just mentioned earlier.
And then when we are talking about treatments, for a patient, I remember you telling me there are both medicinal and alternative measures that they can use.
Sure.
Because this is something that you have to maintain for the rest of your life. Your health has to stay healthy. In that aspect, I would love for you to give our audiences some advice on what they should look for and what treatments there are available for this.
Sure. So sometimes less is more. Sometimes depending on what the person is presenting it with, I don't necessarily take out the big guns and start treating them from there on.
Right.
We talk about other things that they can do. If they're experiencing hot flashes, having a fan on them, making sure that they're residence that has the proper air conditioning.
Right.
There are things like chill pillows that you can use. So if you're having a hot flash in the middle of the night, you can actually be sleeping on a layer of ice without having the ice right on you. And these are all ways to help people feel better without necessarily having to take medications.
Right.
I advise them, wear layers so that if you're having a hot flash at work, that way you can take off a layer. You don't have to wear the same thing that you were wearing if you weren't wearing different layers.
Yeah.
And that can help.
Yeah.
Drink cool beverages. Make sure that, where you're working, it's well aerated. So there are different ways of treating yourself,
right,
or treating the symptoms without having to take medications.
But then there is medication available, and people talk about it. We've heard on hormonal therapy. We've heard a lot on, finding different outlets that mimic estrogen, as you were telling us earlier before this interview too. What is your take on that?
So, hormone replacement therapy is now used cautiously and judiciously, and that's the way it should be used.
Okay.
The reason being is because there is a very well-known study called the Women's Health Initiative that was done by the NIH, National Institutes of Health, and they studied about more than 160,000 women for a period of 15 years, and the ages of those women were from 50 to 79. And with that, over those 15 years, they found that there was a slightly higher risk of breast cancer with hormonal replacement therapy, and that was a combination of both estrogen and as well as progesterone. There was a slightly higher risk of stroke. There was a higher risk of heart disease, higher risk of urinary continence, and higher risk of blood clots as well.
Wow, that's quite intense.
Yeah.
So how do women then make sure that they're still healthy and using the safest forms of methods if they do need that help?
Again, talk to your doctor.
Yeah.
Your partnership with your doctor, whether that be an internist or a gynecologist, is crucial, because then they can guide you. If you're really, really suffering from these symptoms and you need hormone replacement, we assess you and determine your risk. Are you at higher risk for breast cancer? Are you at higher risk for endometrial cancer? These are sometimes
right,
estrogen-driven cancers. So we do a thorough evaluation of the patient, and then after going through all of it, we have a mutual discussion. Is this something that you want to be on? But there are certain patients where I would not prescribe it for. For example, if they've had breast cancer themselves,
right,
if they have a strong history of breast cancer, if they've had a history of clotting, if they have any kind of liver disease, if they have heart disease. These are conditions where estrogen replacement is not recommended at all.
Wow, so that means everyone, as we keep on saying on the show all the time, that do go visit your doctors, reach out to them if there are questions. Of course, you can all reach Dr. Soma Mandal on her website and on the phone number, but also you need to understand that it's important to relate that connection and to know that you have to seek help. Wouldn't you say that?
Yes, that's correct.
And Dr. Soma, I have to ask you, being a woman yourself and helping so many women, I'm sure you must have seen patients of all ages going through issues of menopause, and even, I'm sure you must have so many patients right now. How has your personal journey or experience been with those women? Must not be easy on you either, right?
It's not easy on me because you want your patients to be happy and healthy, and sometimes, because they're going through the change, it can be difficult. But with that, I tell them that this is not a sentence. This is a process of your life. And yes, you're going through it.
Right.
But sometimes we even have conversations about reinventing themselves, about doing things that they weren't able to do before because they had young children who are now grown.
Right.
Doing different things in this different part of their lives. So I don't like to talk about it as this is the end.
Right.
I like to look at it as this is a beginning of a new stage of your life.
And it's completely natural. I mean, this is how life is supposed to be, right?
Yes.
It was just set for us. It's not like we decided to do this.
Yes.
You know, you have had such a passion for women's health, and you speak so highly about various topics that I would totally say would be so taboo in the South Asian culture. Where is that passion for women's health coming from for you? And also, if you were to tell certain women or just women in general, you know, anything about women's health, of how they should really help themselves, what would you say? Just as a woman yourself.
So actually, I never knew that I had an interest in women's health, believe it or not,
Wow.
until I was fully practicing. And so this was back in New York when I practiced in New York City. And suddenly, as my practice was growing, I noticed that I was getting a lot of women patients and that I really, really enjoyed helping them and conversing with them. And that was 10 years ago. And
Wow.
so this has been, it was an evolution for me and a realization that this is something that I really love.
And I'm sure they must really connect with you, right? It must be easier to connect with someone who can understand what you could be going through because you're also a fellow woman. How important do you think it is for us women in general to have a camaraderie and also a conversation time on these kind of topics?
I think it's crucial, in all honesty, and I think that's why my patients, especially my women patients, seek me out, because they see me as not just as a physician that can help them, but someone who also experiences health issues and is going through similar things that they are going through. I'm not immune to these things just because I'm a doctor.
That's true.
And so they recognize these things, and I'm very open and honest about talking about these things if I can share a personal, issue of mine with them. So it is very important for women to connect and bond and have support groups for each other, because we're not in it alone. We're all going through different things, and then there are things that we're going through that are the same.
That is actually so true. That's actually a way to find a connection, perhaps.
Yes.
Thank you so much for being with us here on the show today, Dr. Soma. One last tip or advice you'd like to give to all our audiences here on the topic of menopause and for women to just really focus on their health?
Don't be afraid of visiting your doctor, of having that conversation, of admitting that you are going through a change in your life. We're here to help you. We're here to guide you if you're not feeling well. We're here to help you in terms of your general health, your bone health, your heart health, your breast health. And we can educate you and also help you to live a healthy life throughout.
Definitely. Well, thank you so much for joining us today on the show, everyone. Remember to send us your questions for Dr. Soma on info@itvgold.com. Come to us with all the questions, ask her anything, and if you really want to connect to her, she's there. Join us for the next episode of Desis and Health, where we bring you a little closer to South Asian health awareness and so much more. I'm Aditi Lamba, signing off.